Secretary Health, Ms. Preeti Sudan, Secretary Science and Tech, Dr. Ashutosh Sharma, DDG WHO, Dr. Soumya Swaminathan, Dr. Poonam Ketrapal, and Nick Lusika Mona, all of you, distinguished participants, guests, ladies and gentlemen, good evening, and a special welcome, a very warm welcome to all our foreign delegates, and I hope you are enjoying your stay in India. And since morning, you've had very fruitful and meaningful deliberations. I'm very happy to join you all for this 5th Global Forum on TB vaccines. And I congratulate the organizers for bringing together this august gathering of eminent researchers, academicians, policymakers, students from various government and non-government organizations across the world to review and discuss the status update and the way forward on TB vaccines. Through concerted efforts spanning several decades, developed nations have managed to defeat TB by improving their social and health indices. But the sad truth is that TB remains a leading cause of death worldwide. And in fact, the popular perception to this day is that TB is a disease of the past. Unfortunately, India has a different story to tell. If we look closely, we'll find that people suffering from TB are part of our personal, professional, as well as the social networks. And India accounts for 18% of the world's population and 27% of the global TB burden. In 2015, nearly 4.8 lakh people died from TB, and there were 28 lakh new cases of TB just last year. TB is a curable disease, and the cure for TB has been available for several decades now. In fact, under the Government of India's RNTCP, the Revised National TB Control Program, diagnosis and treatment services are available free of cost to all patients, and approximately 9 million persons were screened for TB, and 1.4 million patients were put on treatment by the government in the year 2015-16. The problem is getting further compounded by the emergence of the drug-resistant forms of the disease, which are extremely difficult to treat. The government has decided to attack this issue head-on by adopting a multi-pronged approach, and innovative strategies for TB care and prevention are being designed and implemented to find, treat, and cure every case of tuberculosis. Systems of care that are being evolved and proactive in approach rather than being reactive. This, along with a clear priority to deliver high-quality health services to vulnerable and underserved populations living in the hard-to-reach areas, with a key priority for us. The ICMR has undertaken a very innovative project to bridge the gap in the last-mile service delivery to underserved tribal populations, and 35 mobile TB diagnostic vans equipped with X-ray and sputum microscopy facilities have been deployed across 17 districts in the states of Chhattisgarh, Madhya Pradesh, Gujarat, Rajasthan, and Jharkhand, covering a population of about 176 lakhs. Whereas the outreach to detect and treat is important, it is equally important to prevent the disease, wherein the vaccine plays a major role. Very appropriately, this 5th Global Forum on TB vaccines is being organized in India with the ICMR, the Department of Biotechnology and Translational Health Science and Technology as partners, and the Central TB Division to commemorate this special day. The Global Forum on TB vaccines offers a unique opportunity for all the stakeholders interested and involved in the research and development of the new TB vaccines to come together to share new data, identify and promote innovative and transformative approaches to TB vaccine R&D, review progress and discuss the path forward for this important research, and to identify the opportunities, new partnerships and collaborations. My best wishes go to all the people who've been working tirelessly to bring a new TB vaccine for preventing TB from thought to finish. I'm sure the positive results will generate the evidence to build a strong case for countrywide scale-up. Ladies and gentlemen, I'm sure you would agree with me when I say that more needs to be done, and that we have a long way to go in order to eliminate TB. Fortunately, there is a strong political commitment to tackle TB head-on. Honourable Prime Minister of India, Shri Narendra Modi ji, has highlighted the problem of TB repeatedly. He also reviewed the RNTCP's, the Revised National Tuberculosis Control Program's performance on Pragati, a platform created to monitor and review the progress of the government programs. The Honourable Union Minister, Shri the Honourable Union Minister for Finance, Shri Arun Jaitley, in his budget speech of 2017, reiterated the government's commitment to eliminate TB from India by 2025, and again in this year's budget, Rupees 600 crores have been allocated to the nutritional support for the TB patient. So every TB patient gets Rupees 500 per month for the nutritional support. The groundwork is being laid out as the Government of India is gearing up to implement a well-defined national strategic plan to eliminate TB. The Government of India has recently approved the establishment of the India TB Research Consortium at the Indian Council of Medical Research as a mission mode program for developing new tools for diagnosis, treatment, and prevention to tackle TB. The proposed prevention of disease trial through India TB Research Consortium using two vaccines, one is the indigenous vaccine and simultaneously by ITRC, ICMF, shows India's commitment to TB vaccine R&D and reflects an enabling environment for TB vaccine research and trials. This is after so many decades that such a big trial is being undertaken and led by India. The Health Ministry, the RNTCP and the ICMR are working very closely on this project. The government can achieve and deliver more with the support from all of you, the scientific community, the civil society, the private sector, the healthcare service providers, patients, communities, and also the media. The development of new tools, especially vaccine, will have a major impact in achieving the Sustainable Development Goal targets. I would like to take this opportunity to wish the organizers, especially the ICMR and the DBT, continued success in all their endeavors, and I hope they will continue this excellent work and continue to partner with all the stakeholders to support efforts to eliminate TB from India. The story of TB is not just about data and numbers. It's the story of centuries of pain and suffering, of human tragedy that engulfs the lives of patients and also their families. We need to protect people from TB. We need TB vaccine. Thank you all for your time and your kind attention.